Good evening all. I'm Aditi Lamba with the Thurs edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin the episode taking a look at the coronavirus pandemic and its impact. The world has surpassed 160 million cases of COVID-19 with now more than 3.3 million deaths. India, home to many of our viewers, today reported more than 362,000 new cases of the coronavirus and more than 4,000 fatalities. The total number of COVID-19 cases is nearing 24 million with at least 258,000 lives lost. Our prayers and condolences to all who are suffering in India. May more help reach you soon. If you are a non-profit organization sending pandemic relief back to India, please send us your information on events@itvgold.com. We want to highlight all who are helping. In the United States, we are nearing 33 million COVID-19 cases and at least 580,000 deaths. There is a decline in number of cases and deaths currently with a massive push on vaccinating all Americans. On that, inoculations of adolescents 12 to 15 years have begun in parts of the nation. And the CDC today came up with new guidelines on mask wearing for fully vaccinated people. We have to know more on this and the efforts to send help back to India. Here are the headlines. Coronavirus is not going anywhere. Dr. Bindu Balani, Hackensack University Medical Center, New Jersey. Save Indian Farmers organizes planned sale fundraiser, India's COVID-19 crisis, New Jersey. Umiya Dham Hindu Temple holds press conference on sending oxygen back to India in New Jersey. It's time for a short break. Stay with us on Vision of Asia, Voice of the Community. We'll be right back. Welcome back. I am Aditi Lamba and this is Vision of Asia, Thursday night episode of South Asian News. Let's begin by taking a look at the coronavirus pandemic updates and measures. Today, the director of the CDC, Dr. Rochelle Walensky, announced that people who are fully vaccinated against COVID-19 do not need to wear a mask or practice social distancing indoors or outdoors except under certain circumstances. She said, "We have all longed for this moment when we can get back to some sense of normalcy." This has met with criticism by many experts who believe that this could enable a spread of the virus as unvaccinated individuals could also shed their mask. Many experts fear that this is too soon as only about 1/3 of the nation is fully vaccinated. The new recommendation still prohibits unvaccinated people from unmasking. Meanwhile, in vaccine, big news, world's first mass inoculation effort in adolescents aged 12 to 15 has begun after the government here greenlit the use of Pfizer vaccine for children in this age group. On this and much more, earlier today we spoke with Dr. Bindu Balani from the Hackensack University Medical Center in New Jersey. Here's a segment of our conversation with Dr. Bindu Balani. Doctor, one of the biggest news that's coming out here in the United States to deal with COVID-19 today was Dr. Anthony Fauci, who is the leading health expert on coronavirus. He said, if you are vaccinated and you're outside, put aside your mask. And that was again a question into what can fully vaccinated people do when it comes to the mask. So my first question to you is, there's a lot of debate about where to take the mask off and how to take the mask off as well. Is this safe? Is it too early? People are still dying of the coronavirus every single day. Is it wise to take that mask off?
So first and foremost, I think the numbers are definitely on the downward trend, thankfully. Thankfully, with the coming weather, I think coming down on the numbers is always a good sign. With regarding the masking and the need to not wear the mask when you're on the outside is totally dependent upon where you are and what is considered as outside. So if you are out walking your dog and you're going to the park and you're doing it alone, I don't think having a mask on is required. On the other hand, if you are going to be outside, but eating, drinking, whatever, in close proximity to people around you where you do not know their vaccination status, I think it's maybe a little bit too fast to completely eliminate the mask. I think having a small group of vaccinated people together at an outdoor setting, I think is okay. Ventilation is the key. If you can have a well-ventilated outdoor space, I think having no mask is going to be okay. The studies really showed that the rate of transmission in an open outdoor setting is okay. Now, there are some studies that came along from Singapore, etc., where they said the word outdoors, but they may not really have been outdoors, where they have a higher rate of transmission. So I think outdoors, when it's really very well ventilated, I think it's still okay.
Right. Dr. Balani, last year also, when summer came around, we saw a decline in cases. People were able to get out more, and they were able to live somewhat of a normal life, even with the masks on and everything. But later in the fall, those numbers were changed. Do you think that could happen to us, where the summer we could be fine, but come fall, we have to close down again?
But there's a big difference between last summer and this summer. We have quite a few of our people here in population here who are now vaccinated,
right,
which wasn't the case the last time. So I think that is a very, very big factor in stating the need for unmasking, or you can unmask. I still feel that knowing your risk factors and knowing your loving family's risk factors is going to be important, because not everybody may have the same immune response to the vaccines. So if you are in that status where you are a solid organ transplant, you've got a kidney, you've got a heart, et cetera, or you're on chemotherapies, then I think you really have to be very prudent, because you may not have that same protection that you would have had with or without the presence of the vaccine. So I think that is important. And then secondly, you're right. Am I concerned about the coming fall? Of course I am. I think we're all going to be concerned about COVID for the next couple of years. So having another wave coming in after this free-for-all kind of things over the summer, is that scary? It absolutely is scary, especially with those patients who are not vaccinated and or with increased virulence or increased variants that's coming around, which may have potentially an immune escape from the vaccine. I think those patients and those clusters that may come along is going to be a problem.
Right.
But again, to reiterate, right? So the open spaces is actually open ventilated spaces. You're really talking about good ventilation being the key in prevention of the spread.
Your comments on what's happening in India, and how are you observing these numbers? And could that have an impact on us if they're not able to contain?
So it is very, very, very sad to see what's happening there. Thankfully, at least I think there's certain cities now. I have lots of friends in Maharashtra, and actually one of them just kind of texted in the morning saying, thankfully, things are a little bit better under control, a little bit stabilization. But again, India is a very vast country, and the resources and the supply and the demand of various healthcare products as well as healthcare providers is the main issue. It is sad to see so many not being able to get to medical help, not being able to get a simple basic oxygen is heart-wrenching to see. It's really troublesome to see the numbers that went up between March, April, and at the current time in May. We hopefully the peak has happened. I can't really even fathom to see that number, that curve still going up. It's really sad. What does it entail for us? The world is a very small globe right now. It's not flat anymore. It's so close. There's significant globalization everywhere. There's travel every time. And with that comes along the passage of this particular virus from one end of the world to the other end of the world with an ease. And then if you start having mutants that are going to be developing in different parts of the world, we can expect more waves to come through. We already have seen a couple of the Indian mutants here in the US, and we really need to get them very well quarantined off, very well contact traced, so that we can hopefully keep them in silos and not allow it to progress. But that's the fear, that what if we get a wave with the same kind of mutants where we may not have as much efficacy as we would want it to be.
Yes, for sure. India is the second most populous nation in the world. I can only imagine the implications of this if it's not contained. My last question to you is, Doctor, I'd love for you to give us a prediction for the next month or two for United States, and also what you're thinking about India.
That's hard to say, but looking at the curve that we have today, I think that downward trend we love. And we hope that it'll continue going forward this way. The numbers have remarkably come down these past 2 weeks. And, it's nice to see, there's no new admissions for COVID. That would be awesome. But yes, they are going down, and we hope that it's going to stay this way in the upcoming few months. Regarding India, as I mentioned, I think there are a couple cities in different parts where they have been able to have a little bit better handle, but nowhere is it coming down as yet. So we're still talking about yet another few weeks for this acute peak to drop down.
Let's now take a look at India and its devastating COVID-19 crisis that is ravaging the country and engulfing its healthcare system. Experts still cannot say for sure when numbers of cases and deaths will peak, and are concerned about the transmission of the variant in India that is driving these infections. Also, experts believe that India's current cases of nearly 24 million and a death toll of 258,000 are a huge undercount and could be 5 to 10 times higher. Lacking beds, drugs, and oxygen has led many hospitals in the world's second most populous country to turn away people suffering from critical illnesses. The World Health Organization has said that India currently accounts for half of COVID-19 cases and 30% of deaths worldwide. Help, especially oxygen concentrators, are being sent from all across the world to save people of India, and many Indian prophets are working as a part of it. Such a non-profit and a spiritual center is the Umiya Dham Hindu Temple in New Jersey. Recently, the Umiya Dham Hindu Temple held a press conference to announce that it is sending oxygen concentrators to many parts of the state of Gujarat and to others who have been disproportionately impacted by this crisis in India. Many spoke to ITV Gold, giving details about these initiatives and their hopes for India. Here is the story.
I'm Dr. Kirit Patel, OBGYN, practicing in Edison, New Jersey. I'm a vice chairman of the Umiya Mataji Temple in Edison, and I'm the chairman of Department of Obstetrics and Gynecology at local hospital, JFK Medical Center. With the current second waves in India, COVID has hit very hard. What it does that, it cuts off the oxygen transfer from lungs to the body, needs high concentrated oxygen to support the life. Umiya Mataji Temple and Vishwa Umiya Foundation has gathered up the resources to provide the concentrator and has started shipping consignments to the India and try to help our brothers and sisters back home in India, which is a very humanitarian help to the country brother and sister. We are very proud that we could make this possible and do our part as a community members of Indian community at large. Thank you very much. Dr. Kirit Patel, as Atul Bhai introduced me, I'm a practicing gynecologist and obstetrician in Edison. I'm a vice chairman of the Umiya Dham Edison Temple, and I'm a chairman at JFK Medical Center in Edison. As Atul Bhai said, there are multiple reasons and activities that is done out of temple. Manu Bhai explained very nicely what we do medically to provide help here locally and to the motherland. The Umiya Dham Edison provides the platform for the young generation for their spiritual and cultural growth. And we have a talented professional amongst our members representing all walks of life. And for the young generation, we provide the shadowing and mentoring for different specialties that young generation is looking for, whether it is good for them or not. We provide the mentoring for it. If somebody needs a guidance, we have a professional can help them to expose them to a different specialties. So it is the platform which is needed for the young generation to connect and grow under Umiya Mataji's blessings and umbrella. Thank you very much.
Kadwa Patel Samaj of North America, KPSNA, had partnered with many other organizations who are also distributing those oxygen concentrators in various parts of the Gujarat. So KPSNA is distributing most of those oxygen concentrators in the Saurashtra region. VYO, which is Vallabh Youth Organization, is mostly distributing in the Vadodara, Surat region also. And then the Vishwa Umiya Foundation is mostly distributing around Ahmedabad and Mehsana area. We have also partnered with a foundation called Thurs Foundation, who has a footprints around the Surat area. So we are kind of collaborating with various organizations. So all the areas of the Gujarat will be able to get those oxygen concentrations. We had purchased it privately, and also we did not use any of the free transportations like Air India or so, because that it was very time sensitive. We were looking at the patients who were dying in dire need of oxygen. So we basically had airlifted it immediately as soon as we could get hold of those oxygen concentrators, and we sent it by a FedEx, which reached there very promptly, and we started to distribute those also. So currently in Saurashtra region, we have 19 COVID care centers and primary health care centers which are already using those oxygen concentrators. We have also provided hundreds of oxygen cylinders and their refilling facilities for patients to use. And we are also providing other needs like medical needs, medicines, groceries, food, ambulance, testing those patients at the point of contact, and also educating those physicians so that they can properly take care of the patients.
Yat karoshi yadasnasi yad juhosi dadasi yat यत तपस्यसि कौन्तेय तत्कुरुष्व मदर्पणम। विश्वरूप भगवान नारायण ने गीता के माध्यम से सनातन धर्मियों को ये संदेश दिया, एक दूसरे की सहायता, जनता जनार्दन की सेवा। आज पूरा विश्व जब कोरोना महामारी के इस भयानक खप्पर में डूबा हुआ है, तब विश्व उमिया फाउंडेशन ऑफ यूएसए और उमिया धाम परिवार एडिसन दोनों ने कंधे से कंधा मिलाकर अपने भारतवर्ष में रहे हुए परिवारजनों को, मित्रों को, राष्ट्रजनों को जिस प्रकार से सुविधा प्रदान कर सके, उसी प्रकार से कमर कस के आर्थिक सहयोग और संसाधनों की उपलब्धि कराने का एक विश्व यज्ञ आरंभ किया। दोनों शाखा के सभी भक्तों ने, सदस्यों ने मिलकर सब प्रकार से धनराशि एकत्रित करके सरकार के द्वारा आयोग और उससे संलग्न संस्थानों के माध्यम से जनता जनार्दन तक पहुंचाया। साथ में धनराशि के साथ ऑक्सीजन इत्यादि की जो कमी थी उसके लिए भी संसाधन उपलब्ध कराए। आज उसी विश्व यज्ञ, सेवा यज्ञ के उपलक्ष्य में दोनों शाखाओं के सदस्य यहाँ उपस्थित रहकर समाज को ये जानकारी देने जा रहे हैं कि किस प्रकार से कंधे से कंधा मिलाकर ये यज्ञ हो रहा है। तो आइए हम सब माता महामाई को प्रार्थना करते हैं कि इस यज्ञ में जुड़े हुए सबको शक्ति प्रदान करे, और जो इससे पीड़ित है उनको जल्दी से राहत मिले, समाधान मिले, ऐसी कृपा हो। सबको जय माता जी।
As our Sastri explained you that there is a dire need for my organization, which is Umiya Dham, Addison, New Jersey, and we have a sister organization back in my hometown, Vishwamaya Foundation. And the request came in when this coronavirus was after the March. It came in a second wave, very strong. We got a phone call from our brothers and sisters back in India that this country needs help. And the biggest things we all know, pranavayu, oxygen wasn't there. Not a second thought even, entire my organization, you can see the entire team, and many more that part of this Umiya Dham Addison. We took a step right away. We took it very urgently. We treated it at the highest level, and we try to work to defeat this coronavirus that spreaded very deadly in India and especially Gujarat. With that, actually, all of the you can see that all my brothers over here, they're part of our board of Vishwa Umiya Dham as well as the Umiya Dham Addison, New Jersey. We will today operate. Everybody will update you how we have come together, how what the Umiya Dham Addison is a temple, and as a society, and also as a healthcare, how we are going forward. So with that, I'm not going to take much more time, and let me introduce to our president, Arvind Bhai Patel. He will briefly describe what is the Umiya Dham Addison, and then actually we will go with line by line with all the members. They are sitting over here, and they will introduce about this Mahamari. As Sastri said, that how Umiya Dham Addison helped the local community as well as the community back in our own home country, Gujarat and India.
My name is Dinesh Patel. As I mentioned earlier, we have collected over 1,500 oxygen concentrator in all over places in many states in United States. We have already shipped 250 already reached in Ahmedabad. Those going to be delivered to the small village, to the big cities, and any other hospital who needed that one. Also, our consignment is lined up every other day. 150 units is going from various states in United States to that Ahmedabad, India. Also, we have passed and helped. The Vishwa Umiya Foundation has helped to many other organizations. They're needed in their own organization, and Vishwa Umiya Foundation has passed 480 oxygen concentrator to the various NGOs in India. So that is help, and we continue to keep working until their needs in India is fulfilled. Thank you. Also, our reach goal is like many devotees, and they have participated and show their generosity. We collected enough fund over here to send this all support to Ahmedabad, and this will not only use in Ahmedabad, that all oxygen concentrator will going in various part in Gujarat. So this is just not for that one city or one village. This is for entire Gujarat. And what they have decided, Vishwa Umiya Foundation has decided, if the help and support needed in out of Gujarat, they are prepared to send it in many other states in India. So every time, every single consignment when it's reached to that, the destination, before destination is get the custom clearance in Bombay, and they have to verify. In order to do that, we have to send all paperwork for each consignment, each unit, and their description. The custom officer do verified. We have to provide that both NGOs paperwork in order to save their GSTs and all other charges in India. And once they verified, then one of the volunteers, they have organized over their transportation trucking company. So every time they do the tracking their product, they prepare the trucks ready, As soon as this arrive, they take into that Ahmedabad or any other city wherever they have allocated. 2 consignments already went to that Baroda and Surat. And as needed, they're getting pre-calls in India before the consignment arrive, and they prepare for all allocation in India as needed.
It's now time for another short break on Vision of Asia, Voice of the Community. We'll be back shortly. And welcome back. I am Didi Lama, and this is Vision of Asia South Asian News segment. Let's now take a look at non-profit Save Indian Farmers. The organization helps support the plight of Indian farmers and addresses issues affecting the high suicide rate among farmers in India. Save Indian Farmers also helps families of these suicide victims by funding sustainable means of livelihood and projects for them. This non-profit has been putting efforts towards the ongoing protests of Indian farmers since it started last year in India and now is also focused on the COVID-19 crisis ravaging the country. On that, their recent effort brought together a plant sale fundraiser to raise awareness and donations for the pandemic relief in India and projects of Save Indian Farmers. Here's a story coming in from New Jersey.
My name is Teju and I am a volunteer with Save Indian Farmers. As you may know, Save Indian Farmers is a non-profit organization working for last almost 10 years for farmers' issues in India. This time we have this special event. Today is Mother's Day plant sale event, and this event is actually focusing on COVID-19 crisis which are right now happening in India. So for that relief, especially in the Bundelkhand area where we have been working for last 5 years. So Parmarth Samaj Sevi Sansthan is one of our partner NGO in Bundelkhand. We are helping them for a makeshift hospital to provide the oxygen concentrator, whatever we get the funds from this show, this sale actually. So I have Ajit Joshi here. Ajit is also one of the volunteers of Save Indian Farmers, and Ajit being a avid gardener, it was he guided all of us, the volunteers. So Ajit, would you like to talk something about the plant sale?
I think this was the first time that we tried the plant sale. For the first time, I'm quite happy. Thankfully, the weather gods were happy with us as well. So most of the volunteers grew the plants at home, and it's been a fabulous experience.
And again, we want to thank all our supporters, all the people who came. In fact, we sold plants very fast. We didn't expect that. And of course, Ajit said the weather. I also want to thank Anandi here because Dawn to Dusk is the facility which Anandi will take talk more about it. But they are our partners today. So this is their land, I would say, their yard where we could hold this event. And thank you again to Dawn to Dusk, and thanks for all our supporters. And Anandi will talk more about Dawn to Dusk to you.
Hi everybody, I'm Anandi and I'm really happy. I really think that this is a community space and I'm so glad that we could do this fundraiser here. We're really fortunate, beautiful day and wonderful people working for an important cause. Dawn to Dusk Wellbeing Center is located in Dayton, New Jersey. We are a center that offers a day program, a day rehabilitation program for adults with intellectual and developmental disabilities. We have a beautiful center in here, and we're very happy to announce that we are opening our in-person programming in 10 days, May 17th. So thank you, Save Indian Farmers, for just doing the inaugural opening in a way, and what a wonderful way to do it. We already have a lot of participants from our virtual program, so we look forward to serving more individuals in New Jersey. If you have any questions, please reach out to us at info@dawntoduskwellbeing.com. You can also search more about us at www.dawntoduskwellbeing.com. Thank you so much, and thank you, Save Indian Farmers.
I'm Susan.
I'm Mark.
We're from Philadelphia. We came for something else and we just saw the plants, and we love plants, and it's for a very good cause, and it's really impressive that you all are doing this. Thank you so much for helping folks.
Great plants.
My name is Anika, and I had a really great time volunteering here, selling these plants for a really great cause and helping the people in need.
Hi, my name is Rishta, and I'm so glad to be a part of helping to save Indian farmers, and it was a great experience, and there's so many plants here for everybody.
And this wraps up our show for the night. Please send us your suggestions and get your voices and organization on our show. Email us on events@itvgold.com or follow us on Facebook at itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Latil Namba. Take care and be well.